many of you have, autoimmune conditions, and many of you have fertility issues and cardiovascular disease and weight control issues, all of these things that are deeply associated with self-silencing, the way that you were raised and conditioned to interact with the world. I want you to know, the thing is, like, the physiological symptoms that I'm talking about, that I'm treating here, and the way you were raised and the impact of how that affects your approach to the world, the two schools of medicine don't interact at all. There's little to no discussion in the literature for cardiovascular disease around self-silencing and its impact. There's little to no research research and courses to teach physicians, because we all take continuing education courses. There's little to no discussion on how any of these pathologies that we've been talking about are associated with and intertwined with silencing the self. Now, I know some smart aleck physician will come back to me and say, that's because they're not because they haven't been proven that way. And that's a cop-out. Always has been and always will be. How I came to this place of understanding, it's not because I just, wanted to be novel and fancy. I know people that do that. They go out there trying for something novel and fancy so they can make their mark in the world. That is not my approach at all. How I came to understand this is being in the room with you for all of these years and listening to you and caring, truly caring, and then applying a scientific mind to what you bring to me. So when a patient presents to clinic and she has, all of these symptoms of autoimmunity, and I'm trying to get to the bottom of why, spending the time understanding how she's come to this place of stress in her life and the impact this stress has on her autoimmunity, that's just natural medicine. That's how medicine should be. If your patient presents to clinic with autoimmunity and stress is a component, and it is a component, and it's a woman, and you run your labs and you see the markers of stress readily available right there on your labs, then you sit down with the woman and you say, I want to understand you. I want to understand your stress. I want to understand how this comes about.